Hello students, welcome back. So today we are meeting again with another topic, and that is local anesthesia. So in LA we'll be discussing about the definition, theories, composition, its classification, complications of LA and nerve block. So in this video I'll be discussing till complications of LA, and I'll be making a separate video for the nerve blocks. So let's get started. Definition: it is defined as loss of sensation in the circumscribed area of the body caused by depression of excitation in the nerve endings or an inhibition of conduction process in the nerve endings without inducing loss of consciousness. So this basically explains there is a loss of sensation in a particular area, and which is caused by depression of the excitation in the nerve endings, and this loss of sensation in particular area does not induce the loss of consciousness. Okay, I hope the definition is clear now. Now let's see the theories. The first theory is the acetylcholine theory, which is completely discarded or obsolete. Then second theory is the calcium displacement theory. Then we have repulsion theory. Then we have membrane expansion theory. And the last, which is the most accepted theory, is specific receptor theory. So we'll be studying only about the specific receptor theory. So it is the most accepted theory, and LA is a weak base. LA acts by binding to the specific receptors or the sodium channels, and these receptors are two types, M and H. H receptor basically causes the inactivation by blocking the gates. LA in its unionized form. Student, this is very important, in which form LA basically acts. So LA acts in its unionized form. It blocks the voltage gated sodium channels, so there will be no entry of the sodium ions. So there will be no depolarization and no generation of nerve. Since there is no generation of nerve, so there will be a numbness effect. Okay, and students, just remember that each and every line is a pointer, and the question can come from any line, like which is the most accepted theory, or LA is a weak base or a strong base. So basically every line is a pointer, so just carefully note down each and every line. From this section, a very important question comes. Examiner usually ask. I'll be telling you that question in the later on slides. So let's see. Composition: LA lignocaine 1 ml 20 mg 2% as a vasodilator. Then we have vasoconstrictor adrenaline in the ratio 1:80,000, and students, please note down the ratio 1:80,000. It usually comes in exam. Then we have reducing agent sodium metabisulfite 0.5 mg, preservative methyl paraben 1 mg, fungicide thymol, vehicle distilled water, and buffering agent is sodium chloride. So this is a composition. This can come as a short note in your exams, in your theory exams, and in your practical exams also. They can ask in a viva, like tell me the composition, which is a reducing agent, and tell me the fungicide or the buffering agent. So this is how the questions are asked. Now let's see what is the classification of local anesthesia. So the classification states it is of three categories. First is whether the drug is of ester derivative or the amide derivatives. Then we have short acting, intermediate acting, and long acting. Then the third classification is whether it is injectables or surface LA. Now let's see esters and amides. So procaine and chloroprocaine, they belong to ester category. Then we have amides, bupivacaine and lidocaine. Then let's come to the second classification. Short acting, procaine, chloroprocaine, and articaine. These three drugs are the short acting drugs. Then intermediate we have lidocaine. In long acting we have bupivacaine and dibucaine. Then we come to the third category, that is injectables. In injectables, we further have three categories, that is short acting, intermediate acting, and long acting. So I have already explained you about the short, intermediate and long acting. So let's see the surface LA, that is topical. In this we have lignocaine, cocaine and tetracaine. Now let's see the metabolism of local anesthesia. So we have esters and amides. So esters are basically metabolized in plasma while amides are metabolized in liver. This is very important viva question. Examiner asks where esters are metabolized and where amides are metabolized. And one more very important question that examiner asks, suppose if a patient is suffering from any kind of liver disease, then what is the drug or what is the LA which you are supposed to give to the patient so that there should not be any toxicity. So since patient is already suffering from a liver disease, so we are not supposed to give the drugs or the LA which metabolized in liver. So in that case we'll be giving the LA of ester derivative. Okay, so we can give procaine, chloroprocaine, etc. And students, we cannot give cocaine also, although cocaine is a ester derivative, but it is an exception. It metabolizes in liver. So let's see. Ester is metabolized in plasma, and the enzyme that is involved in its metabolism is pseudocholine esterases, and the process is called hydrolysis. And in this process the byproduct is formed, which is para-aminobenzoic acid. And students, you have heard of many patients, they are allergic to LA. This is because of this agent, this byproduct, which is PABA. Okay, so this is basically the product which is causing allergies to the patient. Now esters, procaine and chloroprocaine, they are vasodilators, and cocaine is a vasoconstrictor. And all the esters are metabolized in plasma, but cocaine is an exception. It metabolizes in liver. Okay, so let's see amides. It metabolizes in liver. Bupivacaine is very cardiotoxic. So examiner generally asks, they can ask, can you name anyone LA which is cardiotoxic? So you are supposed to say bupivacaine, and bupivacaine is a drug which is safer in pregnancy and post iliac crust grafting. Okay, and now see articaine. Even in case of infiltration, it can work as a block. Okay, so this is all about metabolism of LA. Let's see. Okay, so this is the question that I was talking about. In case of pus, why LA does not act? Because LA, as I have explained you earlier, it acts in its unionized form. LA is a weak base and it acts in its unionized form. When the LA is in this form, it enters into the channels. Okay, in acidic medium there will be more protonated form and less unionized form. So that is the reason why LA does not act in acidic medium. Now let's see the complications of LA. So we have local immediate complications and delayed complications. So let's see about the local immediate complications. Inadequate hard tissue or soft tissue anesthesia. This is either due to the presence of acidic medium. As I have explained you, in the acidic medium, LA does not act properly because unionized form is lesser in amount, or it could be because of the improper technique. So what we are supposed to do, we have to re-inject the LA with proper landmarks. Okay. Then second is there can be burning or pain on the injection site. So it could either be because of the barbed needle blunt or rapid injection. Means the LA has been injected to a patient very rapidly. So what is the ideal rate? Ideal rate is very important. It can be asked in viva. It is 1 ml per minute. So ideal rate is 1 ml per minute. Now third is needle breakage, usually at the hub site. Sometimes the needle breaks at the hub site. So what is the management for it? We are supposed to take IOPR in 2 planes, and if it is visible, remove it with Meggle's forceps. Students, just note down here, it is a star mark point. you have to name the forceps which is used to remove the piece of the needle. So it is McGill forceps. Okay, it can be asked in viva, so just remember and focus. Now let's come to the delayed complications. So first is trismus. And what do you understand by word trismus? It is the limited mouth opening due to muscle spasm, inferior alveolar nerve block, rapidly injecting causes. Why it occurs? When you are injecting repeatedly, so it causes a trauma in the blood vessels leading to hematoma. Okay. Treatment: you can give analgesics along with muscle relaxant, but if there is a case of infection, you're supposed to give antibiotics along with, followed by physiotherapy. Okay. Soft tissue injury: numbness of lip and chin after inferior alveolar nerve block. This is either due to lip biting in children post LA or injury due to hot liquid. So what would be the treatment? There has to be proper instructions to the patient post extraction. What are the things that patient supposed to do post extraction? There has to be the proper instructions to the patient, and cotton rolls should be placed between lip and the teeth. And what are the instructions? First of all, you will be telling the patient you are not supposed to take any hot stuff, any hot food. Advise patient to take ice cream, to have ice cream post extraction, and at least keep the cotton gauze at least till 45 minutes after extraction. So these are the instructions which you are supposed to give to the patient. Okay. Now let's see the next complication, that is hematoma. Accidental injury to the artery leading to effusion of blood to extravascular space. It is common in both PSA, that is posterior superior alveolar nerve block, and inferior alveolar nerve block. In PSA, there will be extraoral swelling, but in inferior alveolar nerve block, there will not be any swelling. So this is how you're going to differentiate that whether this injury is because of PSA or inferior superior alveolar. Okay. Now next is diplopia. It is the rarest complication of PSA. Treatment for it is, for PSA, apply direct pressure pack posterior to maxillary tuberosity, an application of pressure at the bleeding site, and third is eyes application. Okay. Now sludging and necrosis of tissue. It occurs in hard palate area. Why? In case of prolonged ischemia, that causes the necrosis. Now we have transient facial nerve paralysis. It is a complication of inferior alveolar nerve block. Parotid gland from posterior border of infratemporal space and terminal branches of facial nerve lies in this area. So what will be the features? Symptoms: no blowing of air and absence of wrinkles. So this is transient facial nerve paralysis. So that's it, student, for this video. I hope I have made your